All right, everyone, we are going to delve into the first topic. I'm excited, so we're just going to get to it. The first topic at hand is nursing school. Why nursing school? Why do you want to be a nurse? The reason why this topic is special to me really is because my second job that I applied to here in Midtown Atlanta, when I went for my interview, my director at the time, his main question that he asked me was, why did you become a nurse? Why did you want to be a nurse? And that actually tugged on my heartstrings a little bit because, and this is a safe space, and this is actually the first time that I'm saying this out loud to anyone. So the reason why initially I became a nurse was because I knew that I wanted to work in healthcare, but I didn't think that I was smart enough to be a doctor, which is crazy because 10 years later I go and get a PhD in nursing, right? But honestly, I didn't feel like I was smart enough to be a nurse. And I think it worked it was beneficial to me because now I can't see myself as anything but a nurse. I eat, sleep, and breathe nursing. On top of taking care of patients and making sure that patients are well, I'm a nerd when it comes to nursing. I want to know all things nursing. I want to know how to do all things. I want to know how to do all procedures. I want to know all policies. I want to know the research behind it. I want to know the why. I want to know the story. If any of my students out there is watching my video, they know in my classroom, tell me the story. I want to know the story behind it. I want to know the why. I want to know the who, the what, the where, the when, the why, the how, and then how do we fix it? The body is a machine. And once I got that notion about nursing, the body is a machine. And this is how the machine is supposed to operate. Disease happens when the machine is not operating to its maximum capacity, to its maximum ability. So once I learn and understand how this machine works, when disease happens, what happens to the machine that is supposed to be working? How is it affected? Who does it affect? How do I fix it? Once I got into that mindset about nursing, there was no holding me back. So whenever anyone asks me, why nursing? Why did you become a nurse? Because the body is a machine. The machine is supposed to work in a specific way. When it is disease stricken, it impacts how this machine works. I want to know what that disease is, how that disease works, and how to fix it. And not only do I want to do that, I want to continue in the care of the patient. This is what makes you a nurse. I want to continue in the care of the patient. Now I want to teach you about what just happened. Now I want to teach you about how that just happened. Now I want to teach you about ways to prevent it. And I want to continue to see you because I want to make sure that everything that I have educated you about, that you are fulfilling and that you are successful in it. And then I also understand that there will be times that we fall off the wagon. Right? There will be times that our patients are going to fall off the wagon and not going to be as successful at taking their medicines and following their lifestyle changes. I want to be that person. I want to be that person that's there for that patient. I want to be that person that patient has to look forward to. I want to be that safe space for that patient to come to and tell me, I was doing all the things that you told me to do, but this wasn't successful. This wasn't working out. These were the challenges that I was having. I don't want to be the person with 25 to 30 patients on my schedule and I can only see you 5 minutes at a time. I don't even really have a relationship with you. I want to be, and I think that's the reason why I went and became a nurse practitioner and then got my PhD in nursing, because I wanted to have experience in all of those areas. Right? The caring for the patient, the policies and the procedures, the prescriptive power to prescribe medications to my patients, to be the advanced practice nurse, as well as the research aspects, creating my own research as a doctor of nursing that will actually impact and provide additional information to healthcare. So one thing, if you're thinking about going into nursing school, the question that I want you to ask yourself is, why do I want to be a nurse?